Welcome everyone to Living Well with the Blood Cancer virtual conference. The Leukemia Lymphoma Society of Canada is proud to introduce this presentation titled Mind Matters, Managing Mental Health During and After a Blood Cancer Experience. This 60-minute live webcast with Dr. SarahRose Black will focus on addressing the critical aspects of mental health of people impacted by blood cancer, including anxiety, depression, and stress. It aims to provide people in treatment, in life after cancer, living with a chronic cancer, and caregivers the knowledge and tools needed to navigate the psychological challenges associated with the blood cancer. Before we begin, let me introduce myself. My name is Daniela Sinisi, and I am a Community Services Lead here at the Leukemia and Lymphoma Society of Canada. I will be the moderator of this online event. We invite you to type your questions and comments in the Q&A box of your Zoom webinar panel throughout the presentation. A LLSC staff member will monitor the questions, and I will read some of your questions out loud at the end of the presentation. I would like to remind everyone that due to the large number of participants and limited time, we may not be able to answer all the questions. Please note that Dr. SarahRose Black cannot answer specific questions about a person's health, history, or status. Lastly, today's presentation will be recorded so that you can re-watch it again on our website. Next slide, please. As we come together from across Canada, we recognize that we are on lands of many Indigenous nations. We honor the First Nations, Inuit, and Métis peoples whose deep connections to these lands enrich our community. We value Indigenous voices and are working to ensure they are truly represented in our leadership and staff. At the Leukemia and Lymphoma Society of Canada, our commitment to diversity, inclusion, belonging, and health equity guides how we work to support and uplift everyone affected by blood cancers. Next slide, please. Are you looking for specific programs or resources but are not sure where to find them? We are here to help. You can connect with the community services lead in your area to receive personalized assistance and get connected to resources in your area. We can listen attentively and with compassion to the challenges that you are facing, point you to information specific to your type of blood cancer or treatment, help you get organized to manage and take charge of your care, and identify services that would be beneficial for you. Next slide, please. We know that having a diagnosis of blood cancer can be very overwhelming, but know that you are not alone. There is a blood cancer community that is here to support you every step of the way. As mentioned earlier, you can access one-on-one support to help you navigate the blood cancer experience. Next slide, please. On our website, bloodcancers.ca, you will find tailored information and resources, including resources specific to taking care of your mental health. Our goal is to better serve our community and offer an improved online experience. Next slide, please. The information and resources on our website, bloodcancers.ca, are tailored and presented in multimedia formats to address the variety of needs and preferences of our community. This includes fact sheets and booklets, like the one you see on your screen, along with podcasts from our channel called The Blood Cancer Experience. Two resources to also check out are a podcast and animated video on cancer-related distress that speak to the importance of attending to the emotional and psychosocial impacts of a cancer diagnosis. Visit bloodcancers.ca to read, listen, and watch all of these great resources. Next slide, please. Experiencing cancer firsthand may be the most difficult time in your life. While you may not want to burden others with your illness, cancer is not something that you should be facing on your own. We also offer support programs, including our virtual support groups and our First Connection peer support program, where you can connect with other members of the blood cancer community. These virtual support programs provide a safe space for connection, sharing, and discussion. Visit our website, bloodcancers.ca, or connect with the community services lead in your area to learn more. Next slide, please. It is now my pleasure to introduce today's speaker, Dr. SarahRose Black, who is a certified music therapist and registered psychotherapist, specializing in palliative care and psychosocial oncology at the Princess Margaret Cancer Center and her private psychotherapy clinic, Whole Note Psychotherapy, in Toronto, Ontario. SarahRose is a pianist, vocalist, music health educator, and researcher, and has performed, taught, and presented on her clinical work and research across Canada. SarahRose specializes in educating healthcare providers in the use of music as a tool for optimal wellness, and is currently an adjunct professor at the University of Toronto and a graduate instructor at Wilfrid Laurier University. Thank you so much for being with us today, SarahRose. I will now pass it over to you to begin the presentation.
Thank you so much, Daniela, and thank you for the kind invitation from the LLSC. I'm delighted to be here and to dive into this really important world of managing mental health, whether as a person diagnosed with a blood cancer or as a caregiver. So a warm welcome to everybody. I wish we could see all of your faces, but I'm trusting that we're all gathered together in this virtual space, and I wanted to welcome you all in whatever experience you are bringing into this space. Whatever you are carrying, whatever you are holding, may you feel welcome in your experience, and may we have about an hour together of time, resource sharing, and support. I wanted to take a moment and just give you a sense of grounding. I'll do this too. From wherever you are, whether you are seated, standing, lying down, may you feel whatever surface is supporting you. Perhaps you're sitting in a chair or on a couch, or maybe there's a surface underneath your feet. Just want you to take a moment and notice what it feels like to have that support underneath you. Trusting that the supportive surface underneath you is supported by whatever building you may be in. And underneath that is the earth, which is supporting and grounding each and every one of us, wherever we may be joining from today. So that moment of trust and connection with what supports us, may you feel grounded as we jump into these topics. I want to offer you this idea of a mental health check-in, almost like taking your temperature. Where is your mental health at right now? I invite you to think about this question because as we start to explore, you may notice concerns, questions, thoughts, ideas come up for you. And like I said, all of it is welcome. And I'm honoring that everyone is bringing different experiences, but I encourage you to just do a brief check. How are you feeling in this moment? Where are you at? How is your mental health? Do you feel like you're in a good place, that you're thriving? Do you feel like you're looking for more supports? Are you struggling? I'm hoping that we can fill up your toolbox, which I trust already has great resources, and I want to give you an overview of what today will look like. I hope to ground us all in foundational knowledge. So, getting on the same page around definitions of things like mental health, anxiety, depression, and stress. These are massive concepts. We could spend days talking about each one. So we're going to create and hold on to some definitions that will inform us today. We're going to explore mental health as multidimensional. It's not just one experience. You're either mentally well or not. There's so many dimensions to our mental health, and we're going to look specifically at 5 domains of human experience that impact our mental health. We'll look at common challenges while managing blood cancer, which include anxiety, depression, and stress. And I look forward to offering some practical tools and ideas to build your own toolkit, which again, you already have tools, no doubt, that you may be using or may want to tap into. We're going to add some more, I hope. Much to Daniela's point, she already mentioned this. My role today is around support, information sharing, resource offering, and conversation. I will not be offering specific clinical advice, absolutely no medical advice, as I am not a prescriber, but my role today is to invite you to consider different options and resources based on my experience as a psychotherapist and music therapist in a cancer care hospital. And I have been in that space for about 12 to 13 years now. So I've been able to work with multiple people with different diagnoses, but I do spend a lot of time working with people with blood cancers. And I hope to bring some of that in today. If you have concerns, please, of course, speak with your doctor. So let's start by creating a foundation. When we say mental health, as it is such a huge concept, what do we really mean? And I want to be clear that everyone's definitions may differ slightly or significantly, because your definition of mental health has a lot to do with who you are as a person, your cultural and social background, your upbringing, your sense of values, your experiences in your upbringing, etc. So everyone's definitions can be a little different, and that's okay. In fact, I think that's really good. I think it's important to create your own definition and embrace it. Because what might be mental health for me may be slightly different from what it is for you. But in order to feel grounded and I think authentic in managing our mental health, we have to know what it means to us. So let's take a moment. If you have a notebook in front of you or a piece of paper, or maybe you want to type it in on your phone, whatever's easy, or maybe just think about it. Could you define mental health for yourself? What constitutes mental health for you? Is it a sense of safety, a sense of feeling heard and seen and welcome? Is it a sense of trusting yourself and having tools that you can use to cope with whatever life brings? Or maybe it's something completely different. But just start those wheels turning. What does mental health mean for you? I invite you to come back to your own definition throughout this presentation, but also ongoing as you manage whatever experience you might be having right now, either as a person with blood cancer, as a caregiver, as a provider, etc. I'd like to give you a starting point to continue to get those wheels turning. Here are some ideas from the World Health Organization. Again, no one definition is comprehensive, but the World Health Organization has suggested that mental health is a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn and work well, and contribute to their community. I've highlighted human right because I think this is beautiful, that mental health is a basic human right. That doesn't mean that we all experience it all the time, but we have the right to experience it. It exists on a complex continuum, and it's, to my point, experienced differently from one to the next. And at any one time, a diverse set of individual, family, community, and structural factors may combine to protect or undermine mental health. This is key. So many variables can happen that actually shift our sense of feeling mentally well. So we'll talk about those. Mental health is just intrinsically multidimensional. There are so many different parts to it. And we as human beings are multidimensional. We are not just our bodies, despite what sometimes happens in, unfortunately, healthcare. Sometimes providers can see us as just our bodies and, in fact, just the diagnosis versus whole beings who have many dimensions. Our mental health depends profoundly on our attention to the different domains of our experience. Our mental health depends on many dimensions. And if one area is challenged, another area can be affected. If one's physical well-being is compromised, their mental health can be challenged. And vice versa. I like the analogy of an instrument. If anybody here plays an instrument or is familiar with the structure of a musical instrument, especially something as temperamental as a stringed instrument, if one part of the instrument is compromised, if one part is out of place, it affects the entire instrument. And they can be so subtle, right? Some minor change to a tuning peg can affect the entire instrument's well-being. We as human beings are made up of multiple domains of experience. And I like to choose these 5 to focus on when I talk about mental health and well-being, but there can be others. So these are 5 that we're going to start with today, but if you think of an aspect or a domain of experience that's really important to you, you can add it in because we're going to do some workshopping of this diagram. The reason I've created the diagram in this way is that you can see mental health in the middle is touching on all 5 aspects. Mental health can affect our physical health and vice versa. The same goes for emotional health and back and forth. Everything affects everything because we are, like an instrument, dependent on all parts. And I think this is why it is so important to care for our mental health, because it can affect all 5 domains of our experience. From the physical to the emotional, to the spiritual, the cognitive, and the social or relational aspects of who we are. We're going to dive into each one. It's a particularly uniquely challenging time before, like managing the anticipation of a diagnosis, during treatment, waiting for information about how the treatment may or may not be working, adjustments to the treatment, survivorship phases and periods, shifting to different goals of care, and after, managing kind of the aftermath, the after effects of the intensity of these particular experiences. All 5, and again more, domains of your life can be affected, but not just as a person living with cancer, also as a caregiver, as I've noted. I will say this a few times, but I want to make sure it's clear that feelings of anxiety, sadness, and overwhelm are natural responses. These are, and I hesitate to use the word normal, but natural. We'll call it natural responses to the intensity of the diagnosis, treatment, and trajectory of any blood cancer diagnosis. They can also arise at any point during your experience. So you may not feel any or all before finding out about a diagnosis. You may feel all of them, but they also may pop up after the fact in ways that you don't expect. That's also very natural. You may think, oh gosh, I didn't really necessarily feel any sense of depression in this phase, but suddenly here it is. That's natural. There is support available, and there are tools and strategies to cope. This is an important reminder too, because we can feel as human beings swallowed up by anxiety, depression, and or stress. It can feel all-encompassing. There is support available, and there are tools and strategies to cope, even in the moments when it feels like it's impossible to figure out how to move forward. You are not alone. I was very moved hearing about all the resources and the resources I've seen and used for on the LLSC website. It's really excellent, and I'll nod to more resources at the end of my talk as well. I mentioned this idea of a natural response. So we've noted, it seems fairly obvious, but I want to just validate and acknowledge how incredibly challenging it is to navigate a blood cancer diagnosis, because there are so many different stages and phases and so much uncertainty and so much happening, not just to our bodies, but to our minds, our hearts, our spirituality, our cognition, etc. As human beings, we are predisposed to emotional and psychological challenges during and after an acute change in our lives. That acute change could be a traumatic event, something that wasn't anticipated, a cancer diagnosis, a major change. Our bodies and our nervous systems are actually primed to be adaptive and protective. So what do I mean by that? I'll speak more about it in the coming slides, but when something intense, acute, unplanned, overwhelming happens, our bodies and our nervous systems go into a state of trying to figure out how to cope. And that could be the proverbial fight or flight response, where we feel that there's a threat, there is a threat, and we have to somehow address it. We somehow have to fight it or run away from it, or we're frozen in this state of overwhelm. That's our bodies trying to protect us and adapt to the situation. If our bodies just went about our everyday lives when there was a threat, that wouldn't be functional for our species, right? And this may be information you're already acutely aware of and and this may be new information, but maybe a helpful reminder either way. And again, the experience of managing a blood cancer can impact all areas of our personhood and well-being, not just our bodies, but our bodies are often like the first line of response. They go into fight, flight, or freeze mode. I want to nod to the fact that there are so many effective ways to cope that are evidence-based. There's a lot of research done out there as to how to cope and how to be well mentally during these times. But also there's a lot of intuitive ways to cope. You may know what works for you that may not work for anybody else, and that's intuition, and that's experience, and that's just as valid as evidence-based ways to cope. A blood cancer diagnosis can have a physical, emotional, cognitive, social, relational, and spiritual impact on our lives. Again, this is normal because of the physical intensity of treatment. So that physical domain affects our mental health. The emotional impact on one's sense of self and identity, that overwhelm of sadness, of what now, of how do I move forward, who am I now? There can be a shock and overload of information through a diagnosis. So you're learning all of this new information. Here's the plan. Here's what we know. Here's what we don't know. That can be cognitively overloading for our brains to just try and process, especially when we are in a state of shock or fight or flight. Of course, treatment can affect our relationships and our ability to be in relationship, to communicate. It can impact all of these aspects of how we connect with others. And there can also be spiritual or existential questions that show up. And that can be at any point, again, in the treatment. Let's talk a little bit about when anxiety, depression, and stress can show up. So we know it affects all these domains of our experience, and it is normal and natural, and it's our bodies trying to adapt and be protective and cope. Anxiety, depression, and stress can show up pre-diagnosis. So in the waiting period, right? Something is wrong, something's not working properly. You're trying to investigate, trying to figure out answers. That's depleting in so many ways. It can be scary, it can be uncertain. And then when you receive a diagnosis or you receive information about a loved one, then our bodies and our minds go into this state of, okay, what next? What are we going to do? This is overwhelming. There's a huge amount of stress that comes with the changes. And then there's the treatment phase, right? Treatment being intense on one's body, and that can happen in multiple ways. And different people experience treatment side effects differently, of course. There's no one way to go through this. Relapse, potentially, if that is the case, and survivorship, and also changes in goals of care, right? At any point, these experiences can show up. In fact, the Mental Health Commission of Canada and the Canadian Partnership Against Cancer found that the prevalence of depression and anxiety in people treated for cancer is often at least double than the general public. And I put this here not to, be sort of a defeatist, but rather to validate and acknowledge the normalcy, the naturalness of depression and anxiety, and that it is so an experience that many people have. You are not alone. You are not alone. It's your body, your mind, your heart trying to cope and adapt. I noted that we would come up with some clear definitions. Here are some starting points for anxiety. Anxiety is a feeling of worry or unease, a sort of unsettling feeling, and fear that something bad is going to happen. It's a sense of nervousness, maybe it's discomfort, and it's often worrying about the future, something that has not happened, but the worry that it could or would or might. I like to say that anxiety slingshots us into a future that hasn't actually happened. It propels us into a state of something that actually doesn't exist yet or doesn't exist at all. So while feeling anxious when you have cancer is completely normal because so many parts of your state of being go into shock and go into, wait, what? That can cause that anxiety. That's normal. It can get to the point where it completely overwhelms you. And I want to assure you that if you feel overwhelmed by the experience of anxiety and it's actually perhaps disrupting your day-to-day living and it's causing you to struggle to kind of get through the day, it can be diagnosed as a medical condition. That is something that can happen through a family doctor or through a healthcare provider, and it can benefit from treatment. Treatment can be medicine, pharmacological treatment, or it can be talk therapy, some combination thereof, etc. Let's talk about depression. It's one of the most common types of mental distress. It's very, very common in general. But as I noted on a previous slide, prevalence can almost double in people experiencing the uncertainty of cancer diagnosis and treatment, etc. It is again normal to feel sad and or overwhelmed after a diagnosis and during treatment. So much is thrown into question, so much is happening, and it can often deplete our sense of joy, energy, excitement, enthusiasm, because there's so much uncertainty and so much what if and so much change. And that can feel depleting and overwhelming. If you have been feeling these this sense of sadness and overwhelm for a very long time, I put an asterisk there because often we look at a period of about 2 weeks. If that is extending longer than 2 weeks and it hasn't gotten better, it's a really good idea to reach out for support. You can reach out for support at any point. You can be feeling depressed for 5 minutes, reach out for support. Fully encouraged. But if this is lasting for days and days and days and weeks, maybe it might be something you want to talk to your doctor about. And especially if it's holding you back, again, from your activities of daily living, from connecting with others, a really good idea to bring this up with your healthcare providers. You may be at risk for more severe depression if you have a history in the family, if you are experiencing pain, fatigue, or if you're on certain medications or are going through certain types of cancer treatment. It just may put you at higher risk. It doesn't mean that you're going to have an acute experience of depression, but it's important to know. I think the knowledge is important of these risk factors to pay attention to whether these are factors you should be aware of in yourself. Again, like anxiety, persistent and debilitating feelings may indicate a depression that could have a diagnosis and could be treated through talk therapy or medication. Gosh, stress is such a huge, all-encompassing word. It's a word that gets thrown around all the time. And it can happen to varying degrees. Stress volumes can be really, really high in certain times of our lives for different reasons, and also lower given the right kinds of supports, etc. It's a physical and emotional reaction to something that is dangerous or that is challenging to us. A certain level of stress is not necessarily a bad thing because it can actually kick us into high gear and help us act when we need to do something or figure something out. Often that stress response, like our heart's going a little bit faster, can actually kick us into action. Like if we need to move away from something that is dangerous, if our bodies go, okay, here we go, let's do it, and our heart rates go up, it can help us move a little more quickly. Stress helps our bodies get ready to face danger. When you're feeling stress, it's again that adaptive protective response of your body going, we've got to do something here because there is something threatening. However, too much stress can feel overwhelming. We can learn adaptive ways to manage it. I want to nod to PTSD, post-traumatic stress disorder, which again requires a diagnosis. But if you find you are experiencing flashbacks, intrusive thoughts or memories, feelings of numbness, detachment from your everyday life, or a pretty strong sense of anger, it would be something to bring up with your healthcare provider. Anything here could be brought up with a healthcare provider, of course, but I just want to point out that those particular symptoms might merit a bit more attention more quickly. Your nervous system, this sense of managing your state of equilibrium in the world, can go into fight, flight, or freeze response, as I noted, when you feel stress. That fight response is your heart rate going up, and multiple things are happening in your body automatically. You almost can't, well, you maybe could, but it tends to be this automatic response that you can't stop, but you can respond to it. This sense of fighting threat, flying away from threat, or freezing in the face of threat, recognizing when that's happening and learning some coping mechanisms to manage that, especially when there isn't actually an extreme threat in front of you. Yes, cancer is threatening. Yes, treatment can feel threatening. But if you are in a safe place around safe people in a supportive environment, there are ways to calm that nervous system response. Let's bring it back to the 5 domains. Anxiety, depression, and stress can show up in all 5 of these domains, and there are ways to cope in all 5 of these domains, all of which can affect our sense of mental health and well-being. I'd like to just turn it over to you for a moment, and I'd like you to try an exercise again. I'm going to do it with you, and I'm going to give you some suggestions. I call it contributors and challenges to my mental health. So I have a blank template here that's basically this. And what I'd like you to do, again, if you have a pen and paper in front of you, perhaps you want to do this on your phone. It's also okay to just think through it. That's fine. But if there's some way that you could write this down, if that feels accessible or if you'd like to, go for it. We're going to look at challenges to all 5 of the domains, and we're going to look at contributors to mental health in all 5 of the domains. I have a couple of examples here on the screen, which I'll go through. Let's start with physical well-being. A challenge to your mental health could be physical fatigue. Let's talk that through. If you are feeling tired to the point where it's not allowing you to do things you would normally be doing, perhaps the fatigue is completely overwhelming, that can have an impact on your mental health. You can start to maybe feel depressed, sad, overwhelmed. Maybe you're feeling anxious because perhaps you are a person who really leans on physical activity to feel good. Maybe it takes away from a sport that you love or an activity or a hobby that you enjoy. So fatigue is the challenge to your physical well-being. So now that you've named a challenge, let's look at a contributor to your mental health in this domain. Walking once a day. Perhaps that feels accessible. If it does not feel accessible, is there something else that could be a contributor to your physical well-being that could impact your mental health? Maybe it's stretching once a day. Maybe it's even something like going to a sporting event and being present in an experience that reminds you of what you enjoy and something you can look forward to enjoying in the future. So again, can you name a physical challenge? It could be fatigue. Can you name a contributor to your mental health in that domain? I'll give you another example in the physical domain. A challenge to your physical well-being could be pain. And I know that can be a really challenging one to manage, and that can affect your mental health, right? When we experience pain, and I see this a lot at the hospital, it's really challenging to do anything else at all or think about anything else at all. The focus becomes on the pain. Could a contributor to managing that pain be a diversion, like listening to a piece of music that you enjoy, just to take your mind ever so slightly off the experience of pain, take a few deep breaths? That can be like a balm or something soothing to your mental health. I'm going to actually touch on the emotional because I have the same example, because I love music, because I'm a music therapist. I use music every day with my patients. A challenge to your emotional health that affects your mental health could be anxiety about the future. You start worrying about what could happen, what might happen, but hasn't happened. It can cause this anxiety. It can have that profound effect on your mental well-being. A contributor to your mental health could be listening to music you love. Providing that ease, that sense of safety. Music can make us feel safe. Music can make us feel understood. Music can make us cry. It can be cathartic. It can help us let go of emotion we're carrying, right in the core of our being. Let's talk through a couple other examples as you're maybe doing this on your own. I'm going to talk through a social relational example. So just coming back for a moment, we touched on physical and how it can affect our mental health, for example, fatigue. We discussed emotional worrying about the future that can cause anxiety and that can affect our mental health. We talked about listening to music we love as a way to almost counteract gently that experience. Social relational, I'll go through these a little more quickly. we can perhaps feel socially isolated, right? That could be a detriment to our mental health, a challenge to our mental health. Could a contributor be reaching out to somebody we love, reaching out to a friend, reaching out to a support network, reaching out to a psychotherapist, reaching out to a provider and saying, hey, I could use some support? That can then affect our mental health in a positive way. Cognitively, I'll speak briefly. You may have or have heard about brain fog as a symptom of chemotherapy. It may cause challenges concentrating, and it might be difficult to pay attention to things. Perhaps a contributor to that piece is writing things down that you wouldn't normally write down, or taking breaks, cognitive breaks, turning your brain off for 5 minutes every 30 minutes. And allowing your mind to have a pause. And that can be a contributor to your mental health. And then it just gives you that break from the cognitive fog or overload. And then finally, spiritually, a challenge to your own mental health could be a sense of maybe existential loneliness. Like, what's next? What am I doing if I am so uncertain about the future? And that can feel so heavy on our hearts and our sense of spirituality. Can you reach out maybe to a faith community that you've been connected to? Or can you do things like journal and maybe connect inwardly to what it is you're experiencing? Writing things down can actually provide some clarity and some insight on a spiritual level. These are almost like quick snapshots that I'm sort of tossing into your proverbial toolbox that I hope will feel helpful and personalized. Because again, everybody is different. These 5 domains are fairly consistent across the human experience, but our specifics are different. So I want you to just take a moment, think about it for yourself, and feel free to take this exercise forward. Maybe share it with a friend, or maybe come back to it once a week, once a month, once a year, because your mental health can change, right, very quickly. And it's important to keep touching base on what can be a contributor to your mental health in these domains. I keep referencing a toolkit, and I love this analogy because the way I think about it is each and every one of us has a toolkit that is built up of our coping mechanisms. Human beings have built-in coping mechanisms. Our heart rate goes up when we're nervous because we think we have to run away from a threat. That's a built-in coping mechanism. It's not always effective. It's not always helpful, but it's there. You in your own life have your own coping tools. We can always add, adapt, and alter depending on what's going on in our life. In different seasons of life, you're going to need different tools. You need a hammer for a nail, but you don't need a screwdriver if you need to clean up a spill, for example. You need different tools for different parts of your life. Your own mental health toolkit should and could have strategies, resources like bloodcancers.ca, like websites that feel they have great information for you. Your toolkits can be practical, like if this, then do that, and also emotional. Maybe there's a mantra or a reminder, like the phrase, you are not alone. Maybe that's part of your toolkit. It's important to borrow from other people's toolkits and share your own if that feels comfortable. Again, you are not alone. Each and every one of us as human beings have a natural adaptive protective response. Anxiety, depression, and stress can flare up at any time, and you're not alone in this. Allow me, please, to throw in some tools into your toolkit to boost your mental health. So we're going to talk in the 5 domains. Feel free to write these down, take these in. If something does not align with what you think you might need, let it go. I am a huge fan of deep breaths. This is so primal, so primitive, so fundamental to our human experience. And when I say primitive, I mean it's so fundamental to our basic human functioning. I am constantly encouraging patients to take long exhales. Yes, deep breaths. Try and focus on a long exhale. Inhale for 2 to 3 counts. Exhale for 3 to 5 counts. You can extend that depending on how you're feeling kind of in your lung capacity. I know that's different for everybody. It helps regulate that hormone cortisol that can spike when we feel stressed. It can actually decrease it. Long exhales. Putting your hand on your heart can actually bring you into a sense of inner awareness and actually just help you tune in and have a mindful moment, feeling your heart beat. This reminder that you are present. You are present in your body, in your mind, in your heart. It can just regulate, and that like literal touch on your body can be grounding. It can be soothing. I'm a huge fan of meditation and mindful movement. That can look like so many different things. It can be looking up a meditation online or on an app. It can be gentle movement in your seat, moving through nature, moving through even just taking deep breaths and allowing your chest to expand and contract. I encourage regulation practices like being intentional in your showering, like when you are in water, whether it's a shower or a bath, enjoying the sensations and allowing them to ground you. They can be quite healing and soothing, and often we can get disconnected from being mindful and aware. Be aware when you are allowing water to be maybe comforting or soothing or cathartic. Body scans can be helpful, checking in head to toe in one area of your body to the next. How are you doing? How are you holding stress in one part of your body or another? I like to look kind of head to toe and think about where I might be holding tension and then just mindfully bringing some breath and letting it go. Yoga can be a great way of doing just that if yoga is part of your practice or something new. I encourage people to hum. You may hum regularly, just kind of mindlessly, and I don't say that in a bad way. It just might be something you do when you're not thinking. But if you hum, it actually creates an internal massage, and it actually can help regulate your nervous system because you're forced to do deep exhales. And I encourage you to use music. It can regulate your heart rate. Music can actually slow down your heart rate and give you some physical regulation. I'm going to fly through these a little bit, but feel free to take notes as you go. Emotional tools can include naming your emotions, naming them, acknowledging them, and maybe even reframing them. Maybe your sadness is trying to tell you something. Maybe it's not just dragging you down. Maybe it has some wisdom in it. It's trying to tell you something. Journaling is important in moving your emotions through your heart and onto a piece of paper so you're not carrying everything. Writing it down can actually be a very cathartic experience. Reach out when you need emotional connection. You do not have to do this alone. That could be a support group. It could be a close friend or a family member. What works for you is important. Take note of what works for you and use it. Lean into it. Don't forget that you have tools already that are helpful to you. Having variety, like tapping into different sources of different feelings, can be helpful too. So, feeling your feelings and using music to feel your feelings. Music can meet us where we are, it can match our mood and make us feel like, oh God, I'm so sad today. I need sad music. Yes, that's cathartic. Or it can shift your mood. I need to feel something different. I'm going to choose music that makes me feel something different. Cognitively, I really, really encourage support in managing the cognitive load. You do not have to do it alone. And that could be having a supportive person at an appointment to manage the cognitive information that's coming in, or it can be writing things down, or maybe it's if it's, appropriate and if you're able to, even voice recording information from somebody so you can come back to it. I think there's a lot of excellent cancer education out in the world, and again, the Leukemia and Lymphoma Society has a lot of excellent information online leading into that. Writing things down can be a way to offload the intensity of what's happening in your mind and putting it somewhere else, moving information out of your mind onto paper. Have some cognitive quiet time. Shut everything off for a minute, for 10 minutes, for an hour. No screens, no input if you can. Again, a minute can make a difference. The 5, 4, 3, 2, 1 exercise, we're going to do that at the end. You may already know it. Using diversion and distraction in a healthy way can be helpful to shift you from focusing in on something. If your mind is spinning, build a diversion playlist, a playlist that makes you think of other things or takes you somewhere completely different. Ask a friend to share a song with you that helps them go somewhere different in their mind. Stay connected socially. You do not have to navigate this alone. I think it's important, if you can, if you're comfortable, to connect with people in person or online, but connect. Reach out. Express your needs. You don't have to hold them internally. Support can take rather many forms. You can create a treatment playlist. If you know you're going into a situation where it might feel isolating or overwhelming, can you have music playing? I know in some facilities they do that during radiation treatment. You can actually ask people to create playlists for you. Maybe your family and friends can build a music playlist for you, and that can be like company as you move through the world. And it can also help to connect. Maybe you want to write to somebody, and that can feel sort of like this emotional expression, but a cognitive connection as well. And finally, spiritually, maybe you want to connect or reconnect with a faith community or journal and hopefully, explore some insights that may or may not have been present before. It can be interesting to write things down and just see what emerges. You may have some really interesting realizations. Intentional time in nature can be a helpful spiritual practice, and that can lead to actually just slowing down, turning inward, and taking your spiritual pulse, noticing if you do seek out or crave a spiritual connection or a sense of a faith-based purpose, if that is helpful to you. Music can often also connect us to that which is transcendent because it can connect us to that which is beyond words. Know when to seek professional help. Please seek help right away if you're experiencing any of the following: thoughts of self-harm, suicidal thoughts. If you're struggling with substance abuse or an eating disorder, you may want to reach out to professional help, especially if your activities of daily living are being disrupted in a significant way. Proactive support before things feel overwhelming is really, really good. And reactive support is really, really good when you are in the thick of feeling overwhelmed. Support at any time is good. You do not have to wait to feel overwhelmed to reach out for support. Some quick additional resources and supports, of course, bloodcancers.ca, but the Canadian Cancer Society as well, cancer.ca. Wellspring has a lot of interesting resources, but also some support groups that extend beyond Toronto. Gilda's Club is Toronto specific, but also has some really excellent resources. And Sulika Jawad, I hope I'm pronouncing her name correctly, is a wonderful author who's actually done a lot of work in her own process of journaling, which has led to a publication of an excellent memoir. And she continues to have writing available. She is a blood cancer patient, survivor. She writes a lot about her experience in a way that a lot of people have said is very, very, very helpful. So in closing, I'd like to invite the 5-4-3-2-1 exercise. I know I sort of fast-paced threw in a bunch of tools into your toolkit, some of which may be very familiar, some of which may be brand new. But I invite you to do the 5-4-3-2-1 exercise with me in these closing moments. Again, taking from today what felt helpful, leaving the rest, but allowing sort of a curiosity about what tools could be supportive to you, trusting that all 5 domains are extremely important in managing your mental health, whether as a patient, a caregiver, at any stage or phase of this experience. The 5-4-3-2-1 exercise begins by noticing and pointing out 5 things you can see. So from wherever you are right now, what are 5 things that you can see? I'm looking around for myself. I see my computer. I see my coffee cup. I see my Kleenex box. I see my guitar. I see my water bottle. Was that 5? I think. 4 things you can feel. For me, I feel the chair underneath my body. I feel the material of my shirt on my skin. I can feel my feet in my shoes. I can feel my hands holding each other. 3 things you can hear. I hear some construction outside. I hear the hum of the building around me. I hear voices around me, which are comforting in a different building or different room. And 1 thing you can taste. Sorry, 2 things you can smell. Hopefully it's something, just connective, soothing, lovely. And 1 thing you can taste. Perhaps you're intentional in putting a piece of gum in your mouth and enjoying that sensation. This 5-4-3-2-1 exercise is meant to ground you, bring you back to the present moment, and trust that you can stay mindful in whatever is happening around you. You can come back to this as a source of support. And I'm going to pause there and open it up for questions. Thank you all so much.
Thank you so much for the presentation, SarahRose. We truly appreciate you taking the time to be with us today and share your expertise and insights with our blood cancer community. That was a really wonderful presentation. So it is now time for our question and answer period. If you haven't done so already, be sure to use the Q&A box in the Zoom webinar panel to type your questions. As we mentioned earlier, due to the large number of participants and limited time, we may not be able to get to all of your questions today. Please also note that SarahRose cannot answer specific questions about a person's health history or status. So I do have the first question that came in. Was submitted. The first question that was submitted is for those who have a chronic cancer. For instance, this participant who shared that they had been living with the cancer for 12 years and who was finding it more difficult to stay mentally well. So are there any specific tools that you could recommend for coping for a very long time?
This is a great question, and I'm thinking about the fact that, needs change over time as we change, as our bodies adapt to different experiences, especially living with something for a prolonged period. My first instinct is community. Is it possible to find community in chronic cancer? Are there groups or experiences that you can be with others who have similar trajectories? I think breaking the isolation of that is really important because you're not alone. And also being mindful of how your needs have changed and maybe actually acknowledging, like, what were things like for me 12 years ago? What were things like for me 6 years ago? What are things like for me now? What worked in those different stages of experience? What can I draw on? And what am I looking for? What new things can I infuse? But I think also reflecting on what has worked in the past might be a really helpful resource. And not to forget that you've built tools over 12 years, no doubt, and trusting some of those as well. I hope that helps.
Okay, thank you very much. The next question is from a volunteer with an organization that supports Canadians diagnosed with cancer. So the question is, are the suggestions that you have shared applicable to people diagnosed with other types of cancers? And then just the comment, much appreciate all that you've shared from your expertise.
Thank you for the question and the kind comment. The short answer is yes. The short answer is yes. And in my own work, I span, and I'm doing this because I'm thinking about the floors of Princess Margaret, I span different diagnoses and types of cancer and experiences in my work. And I do see a lot of these as um, effective across the trajectory of all different types of cancer. And you can certainly adapt as needed. Some are more acute, some are less acute, but yes is the short answer.
Okay, perfect. Thank you. The next question, so are there any specific types of music that are clinically shown to be calming or healing?
Oh, I love this question, and it's a question that I get often. So the short answer is the music that resonates with you, the music that is meaningful to you, is going to be the music that is the most effective for you. I often get this question, and I will say the things that have been clinically shown to be effective: personalized music. So if there's a song that holds meaning, that's going to be most effective in making you either feel things or maybe even regulating your heartbeat. I will say this: slower music will potentially entrain your body to slow down. Faster music can just effectively entrain your body to speed up. This is just how our bodies respond to music. So if you're looking for relaxation, I often suggest maybe music that's a bit slower. But listen, I have worked with so many people who love like hard rock and that relaxes them. So it's the music that works for you. It's such an individual experience.
Okay, wonderful. The next question is, what was the author of the book that you had mentioned? And if you can spell the name and give the title, please.
100%. Between Two Kingdoms is the name of the book, Between Two Kingdoms. And Sulika Jawad is the author, Suleika Jaouad. If you Google Between Two Kingdoms, you'll find her book. I know it's become quite prevalent in the public space, so I hope that helps.
Okay, thank you very much. The next question, so how can I move on after a diagnosis and treatment? And how do I take care of my mental health when I'm anxious to go back to work, since I had been relapsing every time I go back to work? So are there any advice or recommendations that you could share with us?
Daniela, could you read the first part of that? There's something really significant. The first part of that question again?
Yes. So how can I move on after a diagnosis and treatment? And how do I take care of my mental health when I'm anxious to go back to work?
Oh, thanks. Thank you for sharing that question. And I'm hearing you that there's a history there. If there has been relapse each time, that can create an association, a fear response, of course, because you have this lived experience of a really challenging return to work. This idea of moving on, I think, is really important to sit with. And when I think about moving on, I actually wonder about being with and not having to necessarily, you know, move away from, but carrying that experience with you because it's important and it's challenging. I hope I'm making sense in this brief answer, but trusting that, as time goes, things can change. They do change. I don't know the specifics, and um I do know that sometimes this impetus to move on, which is really, really strong, sometimes I like to encourage people to live, to be with, to carry with, as opposed to move on, if that's helpful. But I hear you. I hear you around the intensity and the compounding intensity of that. So thank you for sharing that.
Wonderful. Thank you very much, Sarah Rose, for your time and for answering the questions that came in. Again, your expertise and insights are very valuable for our blood cancer community. And you've left us with many valuable and practical tools that can help our community manage and improve their mental health. We do have a few more slides before we wrap up together. So if you haven't already registered, there is still time to join the live webcast on navigating the side effects of cancer during treatment, intimacy and sexuality during and after a blood cancer experience, and beyond tired, understanding and managing cancer-related fatigue through physical activity. Next slide, please. We do want to learn about how your blood cancer has shaped your everyday life. So if you have a moment, please take the survey Living with or Beyond Blood Cancer to share your experiences to shape how support changes. Next slide. We would also like to thank Johnson & Johnson, Jazz Pharmaceuticals, GSK, Agman, and Kyowa Kirin for their support in making this event possible as well. And the next slide. And this is something that Dr. SarahRose Black has echoed throughout the presentation, the sentiment that you are not alone. So please remember that, we are here to help you and to support you. You can reach us by email, by visiting our website, bloodcancers.ca, or by calling us toll free at this number on the screen. So 1-833-222-4884. Please note that a short survey will be sent to all participants after the presentation. So we would really appreciate it if you would take a moment just to respond, as it does help us plan and prepare for future events that we will host. So again, thank you very much, Dr. SarahRose Black, for presenting, and thank you all for joining us today. Take good care, everyone.
Thank you so much.